Welcome back. Dr. Monte here with Geeked Rehab. I'm going to show you how to tape your elbow on your own without any assistance from another person, because that's kind of not always available. And this is for tennis elbow or lateral epicondylitis. Your lateral epicondyle is this bony prominence on the outside of your elbow. Okay, it's about right there. When you have this, when you have pain right in here, particularly when you're maybe hammering, wrenching, things like that. Anytime you're using these wrist and finger extensors, those all come and originate from that bone right there. And over time, either chronic use or just doing something that your tendons were not ready to do, you get a lot of pain right there from where they're pulling on their attachment side on that bone. So I'm going to show you a way, instead of using a tennis elbow strap that is just fine to use, but this you can leave on for 24 hours a day for 3 to 5 days and it doesn't get in the way. So first I measure just a little above the bony prominence and go down almost to reach my wrist. Okay? When you stretch the tape, it should reach to the wrist. This one might be a little short, but you should kind of come down just to beyond the bend. All right? And I put a little, you split it to spread out the effects of the tape, and you put a little donut hole in here to go over that bony prominence, because you don't want to put any compression on that bone where there's already irritation. So I tear the top part so I can get to the donut hole. So everybody likes donut holes. So you put that right over that bony prominence where that X is, and you lay the top part down without any tension. I like to stretch the sides away from that, just again to decompress that area. This is the hardest part probably of doing it by yourself, is getting the back of the tape off. But I try to leave it on as long as you can to avoid touching the tape and reducing the adhesiveness of it. Okay, it is possible to get it off. Just gotta have some patience. Okay, so you peel that down, and I only do about anywhere between 15 to 25% tension. And then you can do the tails here individually. You want to put your wrist on a stretch position. You can do it probably like this, gets a little more stretch to it, and you bring it down again 15 to 25%, and then you tack it down again with no tension on the end. This actually turned out perfect because I want it just past the wrist joint. Same thing here, just spread it out to the other side of the wrist on stretch, again 15 to 25%. What that does, it recoils the tape this way, so it helps, it assists in those wrist extensors that's causing the pain here. So the muscles don't have to pull so hard, so it's not pulling so hard on the bone. And then the piece of tape that will basically simulate the strap that you would normally use is this one. It's only about a 2 square length on the back, and I turn it into a Y, again, so you can spread out the tension. Take the back off. I'm going to put that just below the bony prominence where the X is, and I put it just at the bottom of the tape, again with no tension. Peel off one. Now this you want to go 50+% tension, okay? So I do probably usually up to 100. There you go. But the end of it, right here, you don't want to put any tension on that. You don't want to cause any skin irritation or any skin blisters. And I spread this out like a V. Again, no tension. There you go. And what that does, it even helps to dissipate further the pressure that's coming right here. So like that tennis elbow strap, you put that on, instead of the pressure pulling right from the bone, it pulls from where the strap is. So now this black tape is the strap, and the blue tape helps activate and assist those muscles to take some work away from those tendons. So You can leave this on for 3 to 5 days, as long as it's giving you relief and not causing any skin irritation. Take it off very gently and slowly. But this I've found great results within the clinic and personally when I've used it, and you can put it on yourself.